Our our local community mental health has experienced unprecedented funding cuts in the last several of years and is anticipating several more in the years to come. And so, who's impacted by that are individuals with mental illness and developmental disabilities that are no longer able to receive those services. And so, when you ask who's affected by this, it's the most vulnerable in our community. It's kind of the perfect storm in terms of how the funding cuts have taken place. There, two things really have happened. The first is there was an expansion of Medicaid through the state of Michigan, the Healthy Michigan Plan, which was a positive. It gave more individuals access to Medicaid insurance, which is a positive. But the thinking was that how that would impact the local community mental health organizations is that because they would be able to see more clients, they wouldn't need as through Medicaid, they wouldn't need as many what we call general fund dollars, which allows them to do things like prevention and provide services for individuals that don't have Medicaid. And unfortunately, those cuts came very drastically, and they were forced to cut staff, they were forced to cut programming, and again, the people who are impacted the most by that are the folks receiving the services. So that is half of it. The other half of it is we are now a regional community mental health, and part of that is being led by the state and looking at regionalization, and they're looking at a new funding formula for how our local community mental health are able to give to deliver services. And I think over the last several years as a community we've become more aware about mental health, and I think we've broken down some of the stigma of talking about mental health. And there's a reason why you have prominent business leaders like Jeff Elhart that are going in front of camera, going in front of the papers, in front of crowds and saying, this is something that we have to pay attention to. And, I think, again, for years mental health wasn't talked about, and we're becoming more aware, and we're seeing how it affects our families, our friends, our loved ones. We're seeing its impact in schools, and there's more talk of bullying, and there's certainly been an increase in awareness through the number of youth suicides that we've seen in the past year, and again in all parts of the county. So I think we know as a community that mental health is important, and unfortunately at the same time we're recognizing how important it is, we're also experiencing this severe decrease in cuts and not able to provide adequate services to address it.